Ahoy, science sailors! Welcome back to Decoding Long COVID, Dexamethasone, and beyond. I'm Dr. Shikha Agrawal, your captain steering through the choppy waters of this condition. After clearing the mental fog last time, I'm ready to tune up the heart, long COVID's hardworking engine in today's episode on cardiovascular impacts of dexamethasone. As someone who has fine-tuned the molecular gears of Leishmania helicases, I am intrigued by how dexamethasone affects the cardiovascular system. Prachi Virat is here, our microbiology navigator with a passion for microbiome and bioinformatics, ready to chart the course. Prachi, let's set sail. How does this dexamethasone impact the heart in long COVID, and what's the microbiome's role? Long COVID patients often report heart palpitations and chest pain. How does dexamethasone help or hinder the cardiovascular system here?
Great question, Dr. Shikha. Long COVID stresses the heart through chronic inflammation, with cytokines like IL-6 damaging endothelial cell, leading to vascular dysfunction. A 2024 circulation study found 30% of long COVID patients had elevated cardiac biomarkers like troponin, signaling heart strain. Dexamethasone reduces this inflammation by suppressing cytokine production, improving endothelial function. A 2024 Journal of American College of Cardiology trial showed it lowering troponin levels by 25% in long COVID patients with high inflammation, easing symptoms like palpitations. But there is a catch. Long-term use raise risk of hypertension, fluid retention affecting 10 to 20% of chronic users per a 2024 hypertension study. That's due to sodium retention and vascular constriction. The microbiome's involvement too. Dexamethasone dysbiosis reduces SCFA producing bacteria which support vascular health.
Well, that's like repairing an engine while dodging leaks. With your bioinformatics expertise, how does the microbiome influence these cardiovascular effects? And can we optimize dexamethasone's use?
Love the engine metaphor, Dr. Shikha. The microbiome's a key crew member. SCFAs like butyrate produced by Faecalibacterium reduce vascular inflammation and blood pressure. A 2024 cardiovascular research study linked long COVID dysbiosis with a 20% drop in bifidobacterium to worse cardiac outcomes. Dexamethasone exacerbates this, cutting SCFA producers as we saw in 2023 MBiome study. Bioinformatics help us steer. Metagenomic sequencing identify patients with low SCFA producers who need probiotic like lactobacillus to support heart health. A 2024 Nature Communication study used machine learning to predict dexamethasone's cardiac benefits, finding patients with higher cholesterium level had a 30% better response due to anti-inflammatory metabolites. This precision minimizes risk like hypertension while maximizing heart protection.
Well, Prachi, you have powered up our cardiovascular voyage. Let's dock and review, like tuning a ship's engine. You have shown dexamethasone as a mechanic, reducing heart straining inflammation, with that 25% troponin drop being a win. But risks like hypertension are stormy waves, and the microbiome's a vital crew. Bioinformatics is our compass. Prachi, what's your key takeaway?
Ship analogy is perfect, Dr. Shikha. Dexamethasone keeps the heart's engine running, but we must navigate carefully to avoid storms. The microbiomes, our crew, supporting vascular health and bioinformatics, chart the course for personalized care. We are sailors in this long COVID sea, steering toward heart healthy shore.
Thank you, Prachi, for your insights. Dear listeners, thank you for lending us your ear. If you liked the episode, hit subscribe, share this episode, and join us on social media with our hashtags. Let's keep sailing through long COVID. Stay curious.